In vitro fertilization is an assisted reproductive technique which consists of fertilizing an oocyte with the sperm of the patient's partner or a donor in the laboratory. This technique involves several steps. The first step is to perform an ovarian stimulation using subcutaneous hormone injections so that all the follicles of the ovaries can be stimulated and become mature. The ovarian stimulation begins at the start of the menstrual cycle and lasts on average 10 days. During this first step of treatment, the size of the follicles is regularly measured using a vaginal ultrasound, and a blood sample is also taken to monitor hormonal levels. When the follicles reach a suitable size, the second step of treatment consists of inducing ovulation using another subcutaneous injection and carrying out the collection of the oocytes in the operating room under general anesthesia. The procedure is carried out using an ultrasound probe which is inserted vaginally and which contains a needle allowing the aspiration of the liquid contained in the follicles and which is then analyzed by the biologist to find the oocytes. It is a quick procedure that takes place in an outpatient setting. The next step consists of fertilizing the oocytes in the laboratory, either by placing the oocyte in contact with the sperm cells so that fertilization occurs spontaneously, or by performing an ICSI, intracytoplasmic sperm injection, meaning injecting directly a sperm cell into the oocyte. The decision to perform one technique or the other depends on the parameters of the spermogram. Then the oocytes are cultured in an incubator and their development is monitored. Ideally, the embryos are left in culture until the stage of blastocysts, meaning a 5-day embryo. Finally, the last step consists of the transfer of the embryo into the uterine cavity, which is a procedure that does not require anesthesia. For this, the patient begins hormonal treatment so that the endometrium reaches sufficient thickness before carrying out the embryo transfer. This hormonal preparation of the endometrium mainly consists of taking estrogens, orally or transdermally, and subsequently vaginal and subcutaneous progesterone treatment will also be necessary.